Hi, everybody. It's Council President Scott. I want to thank you all for tuning in as we re-air our COVID-19 telephone town hall with Dr. Sharfstein. I cannot stress enough how important this information is for everyone, but especially for our seniors and more vulnerable populations. COVID-19 continues to be a serious threat to our communities, and it's so crucial that we are educating ourselves and taking the necessary steps to keep ourselves healthy and safe by staying inside and staying away from other people. Yesterday, we lost our first two Baltimoreans to COVID-19, and my heart goes out to their families and loved ones. This is serious. We all know the best way to protect ourselves and our neighbors is to practice physical distancing. Staying at home can save someone's life. Everyone can be a hero. It could save your life, your loved one's life, a friend's life, someone else's life who you don't even know. So please stay at home when all possible. I hope that you are able to take away vital information from this telephone town hall, and I encourage you to share this with your friends and family. As always, my office is available to you. You can get in contact with us by just sending us a direct message on Twitter, Facebook, and Instagram at CouncilPresBMS, emailing us at councilpresident@baltimorecity.gov, or calling my office 410-396-4804. Stay healthy, stay safe, and stay inside, everybody.
Good evening, everyone. This is Council President Brandon Scott. Thank you for joining us tonight for this telephone town hall. This call is an opportunity to share important updates with you during this COVID-19 or coronavirus crisis, as well as provide you an additional opportunity for you to speak with me directly and our public health professional, Dr. Josh Sharfstein. I know you're all concerned about the coronavirus, as we all are, and I know you have a lot of questions, which is why we brought Dr. Sharfstein to be on today's call. But before we open up the lines for questions, I wanted to take a second to remind everyone about my number one priority, and that's keeping the people of Baltimore safe during this crisis. Dr. Sharfstein is going to talk about the virus in just 1 second, but I wanted to remind everyone about things that have been issued to keep us safe here in Baltimore. Just a reminder that we should be practicing social distancing at every turn unless necessary. Reminder that bars, restaurants, movie theaters, gyms, shopping malls are all closed. Of course, you can still get your groceries and your carry-out food there. Gatherings of 10 or more people are prohibited, but we know that there are things in place to protect people, like utilities not being shut off, water, electric, gas, and the internet. People will not be evicted. Schools are out at least through a few weeks into April, but we are providing 3 meals and 1 snack per day. And at the request of the mayor, we have the National Guard here in Baltimore to help with the distribution of food and logistics for hospitals. I encourage you all to check the BaltimoreCityCouncil.com website every day for updates around COVID. We'll get the best practices for what you can do from the public health standpoint, and we also provide a map of resources for everyone to see where you can get assets and where you can get food and everything that you need for COVID-19. And the council will continue to do what is necessary to do to meet the coronavirus challenge, and we're going to do that to combat the spread of the disease, as well as supporting our workers and essential services and businesses during this crisis. And lastly, before I introduce Dr. Sharfstein, I want to say thank you to all of our healthcare workers, our grocery store workers, our pharmacists, our child care workers who were working until today when the governor ordered them shut, police officers, firefighters, of which we just found out that 1 police officer and 2 members of our fire department have contracted coronavirus, our public transit workers, which we know 1 at least has the coronavirus. Every city employee that's essential, that is risking their life and their health to make sure that we have some sense of normalcy. We have to thank them each and every day. And now, without further ado, I'd like to turn to Dr. Josh Sharfstein and allow him to introduce himself to you all and also provide some remarks around the coronavirus before we start taking questions. Dr. Sharfstein?
Thank you so much, Mr. Council President. Can you hear me okay?
Yes, sir, I can.
Great. Thank you so much for doing this. Thanks to everyone who's listening. Thanks to everyone who's rolling up their sleeves and, getting to work in all kinds of different ways in your own life and in other things that you do to basically protect Baltimore at this incredibly challenging time. Some of you I'm sure I know. It's good to talk to you again and others. If we haven't met, I'm a pediatrician and a former health commissioner here in Baltimore, and now I'm at the School of Public Health at Johns Hopkins, where I teach and do different kinds of public health related work. So this situation we're in, which just a couple months ago, probably, none of us were really thinking about like this, and now it's transformed our lives. What's going on? What happened was there's a new virus that developed in China. It jumped the barrier from one species to humans, different species to humans. No human being on the earth has had it before when this started. And everyone is susceptible. And it started spreading in China, and then it started spreading around the world. The virus spreads like other colds. It's a coronavirus, which is a type of virus like some common cold viruses, except it's much more serious, and we'll talk about that. And because none of us have had this before, we're not immune, so it spreads more quickly through a population. Every person tends to give it to 2 or 3 other people. And that means, one day there's, one person who gets it, the next day there's 2 people, then 4 people, then 8 people, then 16 people, and it just grows so fast that pretty soon so many people are sick. And it's spread through droplets that come out when you sneeze and cough, or other times, perhaps even before symptoms start, when people breathe out droplets and they tend to settle. And so people touch the droplets and then they touch their face and it gets in through their maybe their eyes if they're rubbing their eyes, or their nose, or their mouth. So it transfers from person to person, and then it gets in your body, and then it starts to grow and replicate. Most people have a generally mild illness that doesn't require them to go to the hospital. About 4 in 5 people don't need to go to the hospital. It can still be pretty rough for them, but they don't need to go to the hospital. Among the people who have to go to the hospital, though, it's much more likely for people to have to go to the hospital if they're older, particularly over 60, and the older you are, the more likely. 70 and 80, very high likelihood you have to go to the hospital. And then for people who have to go to the hospital, about half require going to the intensive care unit, and that often means going on a ventilator. So it's a very high risk, particularly for older people or people with chronic health conditions, to have to go to the hospital and to need a ventilator and even to die. The rate of death is at least 10 times higher than the flu. It's probably a lot higher than the flu, maybe 100 times higher for people in the high-risk groups. I just want to say a couple things. Just because you're not in the high-risk group doesn't mean that this doesn't apply to you. Because first of all, younger people can get very, very sick and even die. It's more rare that it can happen. The second reason, though, is that younger people can pass the virus on. So even if you're not getting that sick, you're a bridge to other people getting sick. You sneeze on something, your parent or grandparent touches it, and before you know it, they're really sick. And if they're in a high-risk group, they're in a very, very serious condition. So what can we do to get out of this situation, which is passing through Baltimore just like it's passing through other cities? Well, right now our goal is to control the disease the best we can before so many people get sick that there aren't enough ventilators for people who are sick in Baltimore. That's a terrible situation to be in. It's a situation that Italy has been in. It's a situation that Spain is getting to, and it's even a situation that's facing New York right now, as so many patients are coming in and needing ventilators, and they're using up every ventilator that they can find. We want to avoid that in Baltimore. So the first thing people can do is take actions in their own lives, and that includes washing your hands frequently for 20 seconds with soap, before and after going to the bathroom, before and after eating, and whenever really you think about it, wash your hands. It really helps reduce the chance that you'll pick something up or put something down. The second thing is when you sneeze, make sure your sneeze is covered, or your cough. Very important to reducing those droplets as they go out. If you're sick, you should cover your face if you're around other people. And that can be with a scarf or a bandana if you don't have a mask. And then if you're sick, you should not be going to work. You should not be leaving the house. You should be doing the best you can to hunker down until you feel better. Because even if you feel well enough to work, you could be giving it to other people who could be then giving it to other people, and that's how you get that rapid growth to happen. Right now, the governor has closed schools. The governor has closed businesses. And the reason he's done that is he wants everyone to stay as close to home as possible, because every time people come in contact with someone else, they could spread the virus. We need to take that rate of transmission and drop it down. During the time that we gain from this, while we slow the transmission, we have to do two things. We have to make sure that our hospitals are prepared, the staff have protective equipment, and that they can care for as many people as possible. You may have heard they're building a new hospital at the convention center. They may turn the Hilton Hotel into a hospital. We're going to need a lot of hospital space because so many people in Baltimore are going to get sick. And we need to give them as much time as possible to do that. That's why everybody needs to stay home now. The other major reason is we need to stand up support for people, particularly people at the greatest risk who we really want to stay home. We need to use this time to come together as a community to find ways to get people food, to find ways to communicate with people even if we can't be in their physical presence, and to develop a public health response to support people with the illness so that they're not in a position that they have to go in contact with others. So this is a very difficult moment, but we know that there are a number of cities that have been able to make it through this. Even if it gets bad, it'll eventually get better. Our goal is to make it as least bad as possible. And it's through events like these and leadership of people like the council president that we can get all the questions out and answered, and people can feel like they understand what's going on and that they don't feel helpless. They don't feel hopeless. There's no reason to feel helpless and hopeless. We should feel determined to do what's necessary to protect ourselves and our community. Maybe I'll stop there, Council President, and you can tell me what you would like to do next.
Yeah, we're going to start, and we're going to go straight into the first participant question now. We want to open up the line for questions. Our first question is going to be from Peggy in Johnson Square. Peggy from Johnson Square, you are up.
Okay, my name is Peggy Johnson, and I'm trying to figure out, they say they don't have any more masks. So what are the people that staying home? How can they get their masks?
So,
sure. Oh, do you want me to answer that?
No, you sure can. Go ahead.
Okay. Thank you for that question. Masks right now are most important for two groups of people: healthcare workers, so that they don't, if they're actually in touch with people who are sick, that they themselves don't get sick, and that has been happening around the world. And second, people who are sick, they have symptoms, they should be ideally home, but always wearing masks. So now, if you don't have a mask and you're sick, then you should be covering your face with something else. And the recommendations there are you could use a scarf, you could use a bandana, you find something, and you want to cover that so if you sneeze or cough, all those droplets go into that, and they don't go all over the place for other people to touch. I think eventually we're going to have enough masks for people to wear in other situations, but, when I go out, I'm not wearing a mask. I think that the value for people who are well to wear masks is, if there is any value, it's much less than the value of people who are sick or healthcare workers to wear masks.
Thank you, Dr. Sharfstein. Our next question is going to be from Tasha Smith from my neighborhood, from Sedonia. Tasha Smith.
Good evening. My question is, how do you determine what businesses were supposed to be closed down? I know Governor Hogan said that a lot of businesses are supposed to close down on Thursday, I believe, at 5 p.m. And I do know of several businesses that are open, and they are sending workers from here to New Jersey, where it's hardly hit. How do we handle that?
So, Tasha, we know the governor's mandate now is that only essential businesses should be open. What businesses are you speaking with that you know of that are still open that you think shouldn't be?
Second chance.
Say again. You said Second Chance?
Mhm.
Okay, yeah. So Second Chance is a business that might qualify to actually be open because of the materials that they sell. But what we'll do is we'll do the direct follow-up with that and check. And if you know of a business that you suspect a business that is open that shouldn't be, you should just let the police department investigate those by simply just calling it into 311, and they'll do the investigation. In this case, we will do it and take care of that for you. And if they aren't supposed to be open, we'll make sure that they are not.
I know they've sent people to New Jersey, and they are going to come back here, and it's just scary.
Yes, ma'am. We're going to make sure that everyone is doing the right thing, and we're going to try to protect all of our workers to make sure that they're safe. Thank you so much for your call. Our next question is going to come from William from Emerson Village. William, you're up.
Hey, good evening, everybody. My job, I work out with a rental company, and we were deemed essential. And I had some coworkers that actually put themselves around people that in some situations where somebody was ill, and they went and got tested. And then I'm an allergy sufferer, and I'm also an asthmatic, so I just went and got tested today, and I'm awaiting my test results. But one of the questions that I had, because I just have a cough with all this pollen, but I just wanted to make sure that I'm okay. But with your clothes, should we be washing our clothes as soon as we come in the house? Or spraying them down, or because we're around a lot of different people that touch stuff.
Yeah. Thank you, William. And listen, I know that I speak for everyone on the call that we hope that you're okay and hope that you're going to continue to be healthy. Dr. Sharfstein, do you want to address that for William?
Yeah, it's a great question. I think if it's possible to change clothes and take a shower and wash your clothes when you come in, I think that's a good idea. I think your intuition on that, what you're thinking there, is the right way. I think it's probably relatively low risk, but there is some risk that the virus can live on your clothes. And I would be really careful about washing your hands a lot during the day. And people who are sick should not be at work, because they could be passing it on to all the places that they're going and the people that they're in touch with. So even while you're waiting for your test, or people are waiting for their test, I think if they're sick and you're worried that you have it, it's probably better not to be around other people.
Thank you, and thank you for your question, William. The next question is going to be from Mabel from Laurelville. We want everyone to try to get their questions out as quickly as possible. We have a lot of people on the call, a lot of folks that want to ask questions, and we have limited time. Mabel, you're up.
Good evening. My question is, hello?
Yes.
Yes, ma'am.
My question is with the seniors. We're told to stay in the house, not to go out. But how do we get supplies? What happens with us? And then everything that happens, they say, if you have an underlying disease. But I haven't seen a list of these underlying diseases, although I'm a senior of 81, and I do have different things.
Yes, ma'am. And Ms. Mabel, Dr. Sharfstein and I will both handle this question. I will talk about the resources that you have available to you. For example, the first thing, Ms. Mabel, what we also are asking people, too, if you have, we know that you need to get out to get your groceries and things like that. We now have grocery stores in the city that are having hours specifically for seniors. So I know where you are in Laurelville, you have a Safeway nearby. Tuesdays and Thursdays from 6 to 9 a.m. at Safeway is available for seniors. Giant, seniors can shop from 6 to 7 a.m. every day. Aldi, there's Aldi close to you too. Seniors can shop from 8:30 to 9:30 a.m. Tuesdays and Thursdays. Also, these places do deliver as well, and you can get that information by just calling the store. But we also want you to connect yourself to the Maryland Access Point for seniors, where they can give you, keep you healthy and safe, and have all the resources and options for you. And that number, Ms. Mabel, is 410-396-2273. 410-396-2273. And the last thing that I will say that, Ms. Mabel, what I want you to do is also call my office tomorrow, and we will try to connect you directly to some other services. 410-396-4804. That's 396-4804. And I'll let Dr. Sharfstein talk about the medical portion.
Sure. Thank you so much for the question, and what a great answer on the your question about what resources are available. So, this is a very serious condition if people get sick. And like I said before, it's particularly serious for people the older they are. And the reason for that, in general, is it's believed that it has to do with the aging of the immune system, that as the immune system gets older, it just doesn't respond to this virus as well. That's why, in general, it's not nearly as bad for younger kids, but it gets worse the older you are. And over 80, like you are, puts you in the high-risk category. And then there are other conditions that make the risk even higher, and those include high blood pressure, diabetes, lung disease, asthma. Now, people have more than one of those sometimes. So I would say it's safe to think that, someone who is over 80 and has any of those diseases, or really over 60 and has any of those diseases, is going to be at higher risk. Now, that means do everything you can to stay as close to home and as isolated as possible for a while. And I would say at least the next month, you should be thinking like that. And you need to be thinking about your own support network and who can help you. Not just, but definitely reach out to the council president's office, but also family and friends who could bring you food, other things that you could do. People you may not want to bother, you should bother them. And everybody who can be of help to someone in their lives really needs to step up. And, there's a term that is used in this called social distancing, meaning staying at home. But social distancing isn't a good term. The better term is physical distancing. We want people to stay away from each other so people don't pass the virus to each other. But that's just physically. We should be in touch, we need human connection. Humans are social people. We need each other. And so calling friends, talking to people every way you can, having visitors even if they're on the other side of the wall, things that you can do to reduce that isolation is important. And this is not, unfortunately, going to be over by next week. It's an enormous threat, and we want everyone to stay as healthy as possible.
Thank you, Dr. Sharfstein. Thank you. The next question is going to be from Susie from Harlem Park. Susie, you're up.
Okay. My question is, has Plaquenil been proven to help?
Thank you. Plaquenil, you said? There are a couple drugs that have been mentioned by people about whether or not they work. The president has mentioned chloroquine and hydroxychloroquine. Some people have mentioned azithromycin. There are a number of different medications that have been tossed about their names. But right now, there are no medicines that have been proven to work. Unfortunately, when the president or someone says, maybe this works, and people run out and get it, it's left patients who actually need those medicines for proven reasons unable to get them. So, what we need, so that's the bad news. The bad news is there's no medicines that have been proven to work, not Plaquenil, not chloroquine. They have not been proven to work, and in some cases they may make things worse. We don't know yet fully about those medicines. The good news is that there are some studies that are underway of a whole bunch of promising treatments, and we will have the results of those studies in the next weeks and months. That's one reason now we want everyone to stay at home, is so we can get that research and find out what really works. And I'll give you an example. So there's a professor named Dr. Arturo Casadevall at Johns Hopkins, and he looked up what people did for diseases in the early 1900s before they had vaccines. And, we're trying to make a vaccine. That's probably going to take a year or more. But what did you do when you didn't have a vaccine? And what he found is that for measles, before the measles vaccine, they would take the serum from people who had recovered from measles infection and give that serum to people who had been exposed to measles or were starting to get sick with measles, and it would either stop the infection or prevent the infection of measles. So this is like research that was done in the early 20th century around the country. And he said, well, we know that there are people who are recovering from coronavirus. What if we took their serum? Because what's in the serum is antibodies. People who recover have antibodies, which are proteins that we make to fight infection. They have antibodies that target coronavirus. So what if we took that out of the blood of people who are recovered and we give it to people who are just getting sick? Could that, stop the spread of infection? So the answer to that question is we don't know yet, but they're starting studies very soon to find out. If that's possible, that would be an example of something that could be available maybe as early as this summer if it turned out to be true. So everybody's racing to do that. There are a number of other studies that are underway, including some at the University of Maryland and Johns Hopkins, to figure out whether something works. And the way you do those studies is, they basically give the drug to the medication to half the people, and the other half the people don't get the medication, randomly assigned. You don't know whether you're getting the medication, and they see whether the people who got the medication did better. And when you do studies like that, and I've been been enrolled in those studies, as a patient, when you do studies like that, then you find out very quickly whether something really works, and then it can be made available to everyone.
Thank you, Dr. Sharfstein. Next question is from Rita from Bolton Hill. Rita, you're up. Rita?
Hello?
Yes, you're up. Hey, how are you?
I'm okay.
You have a question?
I already talked to somebody a few minutes ago. They told me to listen out. I just basically wanted to know, too, if you're going to the market and you're around a crowd of people in the market, can't you still get it?
Yes, you can, Miss Rita, and this is why we also want people to not continuously go unless you have to, and when you're even in the supermarket, to practice social distancing. We know places like John are even putting up plexiglass when you go, wear gloves, make sure that you're wiping down things when you come home, do all of those things. And also, I know that you were asking earlier about your daughter's daycare being shut down, right? So we know these are businesses that are being impacted, and workers and jobs are being impacted across the city, really, and across the country and the world. This is why it's important for us to pay attention to what's happening at the federal level. We know that the federal stimulus package is going to include increased unemployment insurance, and I actually wrote a letter to our federal delegation saying it should be 100% uninsurance for everyone, including self-proprietors like your daughter, but also Governor Hogan at the state level has put out some grants to small businesses. You can get that information at businessexpress.maryland.gov/coronavirus. That's businessexpress.maryland.gov/coronavirus. So thank you. And also be sure to call our office, 410-396-4804. We can give you more information. Next up, we're going to have Julia from Ednor Gardens. Yes. Julia? Yes.
Yes. Good afternoon.
Good afternoon.
I have 4 of the high-risk conditions, which is high blood pressure. I have a immune system problem, and I also have asthma. what should I do when the president is telling you it's okay to go out and about and do? I've been in home for about 3 weeks because I am petrified of going out in the street because I'm afraid to get sick, and I'm 74 years old.
Yes, ma'am. I'm going to let Dr. Sharfstein respond in a second, but the first thing I'm going to tell you is the same thing that I said on TV yesterday. Ignore what the president is saying and follow the advice of public health professionals who know what they're talking about, who are going to tell you things based in science, and now I'm going to allow one to tell you himself what he thinks you should be doing to protect yourself.
You are doing exactly the right thing to protect yourself, which is staying home. And, this is a difficult situation right now. And knowledge is power. And you have the knowledge that this is serious. It does pose a risk to you and to others. And I think this is a general point. I wish I could have just taped what you said about how you're staying home because you're worried and you're scared. And what you're doing is the right thing. And other people should hear you. Other people should follow your example. Anybody who you hear on TV saying it's safe to go out is totally fine. They don't really understand the risk, and particularly not the risk to somebody like you. I don't know if you're following on the news. I'm sure they'll show what's going on in New York, where they have a horrible situation and so many people going to the hospital every day. In one hospital, they could barely get around to see the patients. And so many patients died, they had to bring a truck up to the hospital to hold the bodies in because they didn't have any room in the hospital for them. I mean, I'm telling you this because it's so serious that I think both the council president and I would say, you have to be firm in your convictions. It's hard. This is very hard to do, to wait like this, to be stuck at home. It can be scary, but you're actually taking action to protect yourself by staying home. You're doing exactly the right thing, and I really hope that other people hear what you're doing and follow your example.
Thank you. This is Council President Brandon Scott again. Thank you all for your questions. Thank you for joining us. Our next question is going to come from Twyla from Emerson Village.
Yes, good evening. My question was, I have epilepsy, and I've had it for quite some time, so I guess it kind of messed with my immune system a little too. But I wanted to know if it was best to stay indoors. I know it's good to stay indoors, but if you should have to go out, should it be any special particular kind of precautions I should take?
Dr. Sharfstein?
Sure. So I think you're exactly right. You should stay indoors. Now, if it's possible to go outside and walk around a little bit without being within 6 feet from each other and getting a little bit of fresh air, that's okay. You just have to take precautions. Everything is a potential risk. The elevator, if you're in a building with an elevator, you should be sure that you're washing your hands before you go to the elevator, and maybe bring some hand sanitizer. Your building should be washing down the elevator, and you should hand sanitize right after you get out of the elevator. So anything you touch, you should use hand sanitizer really well. And when you get back to your place, you should wash your hands really well. So if you're going to go out, you have to be really careful every single step of the way. But if you go out and you walk around, don't let people come up real close to you. And if you're going to, you need to go shopping, like the council president said, take every precaution, including the stores, they have the wipes. You wipe down the cart, you wipe down the belt, you wipe down everything you can wipe down. You wait, very spread out in the store, and you come, right home as quickly as you can. And the first thing you do when you get in is you wash your hands really well. So all that serves to reduce your risk. But the more you can stay with as little contact with others as possible right now, at least physical contact. Again, emotional contact's fine. Talking to people on the phone is fine. But that physical contact, the more you can reduce, the safer that you will be.
Thank you, everybody. And again, remember, this is Council President Scott again. I just want everyone to Thank you for all the great questions, because this is a very serious situation, and we have to take it seriously. That's why we did this call. But it's also important for those of us who are younger on the call to spread the information and make sure that we're helping to get the information to everyone. Next up is Claire from Hamilton. Claire, you're up.
Good evening. I just had my questions answered by the doctor, pretty much everything I was looking for. The other question I had was an economic question. In the city of Baltimore, our very last day to pay our real estate taxes is April the 30th. Is there going to be an extension on that?
Yes, actually, at my request, the mayor has extended that, so that all of these things will be an extension on all of them. So thank you, Claire. Thank you for your question.
Thank you.
Next up is Louise from Mount Washington.
Hi. Hello.
Louis, hey.
Hello.
Hey, how are you? What's your question?
Okay, Mayor. Thank you very much for organizing this. My question is Friday night and for Passover, our daughter has decided that she and the grandkids should stay away, and we as the grandparents should shelter at home. Josh, can you address that? Is she right? Or, we've been sheltering at home. We don't have any symptoms. Is she being overcautious and we should be getting together like normal for Friday night and planning for Passover together?
This is your daughter or granddaughter, you said?
Daughter and our daughter and son-in-law and grandkids.
Yeah. Well, they care about you a lot because they're right. I think, and I've had to say this to my own parents. Passover is a holiday for people who are Jewish, like me, and it's a time kind of like Christmas or Easter, where families usually get together. And I remember being with my grandparents and my parents, almost every Passover. It's part of like my life, but not this year. This year we're going to do it over the phone because I'm very worried about my parents. And I think they have the same question. And is there any way that we could do it in person? Because it's part of their lives and their parents and their grandparents. But the answer is not this year. We have to, put our health first. So we're going to be doing it a different way this year, and hopefully next year we will not have to do it that way.
Thank you, and thank you for your question. Yeah, your daughter is a hero. Your family are heroes. I actually had to have this conversation with my parents about not visiting my grandmother, and they just have to call her on the phone or video chat like I do. So thank you very much. The next question is from Barbara from Emerson Village.
Oh, my question is, from the origin of this disease, it sounds like, the way I'm thinking, it's like, is it airborne? Because the people that are dying or dropping out over in China and Italy and stuff, they're not coming here, but they have the disease. So to me, it sounds like it's airborne. What do you think?
Sure. So it's not airborne in the sense that it travels, over the ocean. We know that it came in people. We can find people that brought it. We know that it travels in people. Now, when you're with someone, it's really through those droplets, and those droplets spread in the air, but they don't go over long distances. So really, they go about 6 feet.
What are you saying about droplets? With your nose running or something like that?
Like if you ever when you go outside and it's cold and you breathe and you can see your breath?
Yeah.
Yeah, that's actually water droplets And because it's so cold, it turns into a little cloud. So imagine that a little bit, but instead, with just water droplets, there's virus in all those droplets. So, if you breathe and you're someone standing way on the other side of the street, you don't see that little cloud go all the way over. By then, it's dispersed. But for someone who's standing really close, those droplets can actually, get in their face, get on their hands, settle on their clothes, and that's how the disease spreads.
Thank you so much. Thank you for that question. Next up, we have Diana from Northwest Baltimore. Diana, you're up.
Yes, hi. This is Deanna. My question is, they say that the virus does not like heat. So it's a thing on YouTube where they're blowing the blow dryer up their nose to, I guess, kill the virus. Is that true?
I don't think that's a proven way to protect yourself against the virus, because the virus gets in so far to your body that I don't think using a blow dryer on your nose is going to make much of a difference. And I don't want anybody to get burned or anything like that at the same time. And what you don't want to do is have it kind of break down your normal defenses in your nose and have the virus have an easier route in there, because you can't be running the blow dryer all the time. So you stop the blow dryer, and then if you've damaged your nose and then you touch your nose with virus, it might be easier to get infected. So I wouldn't recommend that as a way to protect yourself. Hand washing. And, I thought I washed my hands a lot. I don't wash my hands nearly enough on a regular day, I realize, now that I've started washing my hands like a crazy person. I wash my hands when I get up. I wash my hands when I go out of my little office. I wash my hands before I come back in. I'm washing my hands all the time. And not just washing my hands, I'm washing my hands with soap. I'm trying to, sing a song each time. You can sing the happy birthday song. You can sing other songs. But the idea is it's hand washing really reduces your chance of getting sick.
Thank you so much. Thank you. Next, we are going to Barbara at Norton Fulton. Barbara.
Good evening. I'd like to know what. Hello?
Yes, ma'am. You're all yours.
I'd like to know what are we going to do to support our healthcare workers in the city. You see in other cities where they are providing housing for the doctors and things so they don't have to go home, because a lot of doctors, I hear that they're sleeping in their cars and things of that sort so they don't carry it home to their families. What are we doing here to support our healthcare workers?
Yeah, thank you for that, Barbara. It's a great question, and this is something that we've been pressing on. I've been working with not just the medical institutions, but working alongside like the unions, like SEIU, that represent our workers in the healthcare, trying to advocate and make sure that they are being taken care of. This is also why it's important when you talk about this federal stimulus package, about making sure that the right protection equipment was available for these individuals, pushing the administration to have the same way that we're going to be having hotel rooms and things for our first responders, to push them to do the same thing for our folks that are working in the healthcare field as well. So thank you very much, and stay tuned.
And can I mention one quick thing to add?
Yes, sir.
One of the most important things, I think that's a great question, and one of the most important things also is to make sure we have enough equipment to support the healthcare workers to stay safe. And as you may know, there's a national shortage going on. But it's been inspiring to see that people in Baltimore are getting together in different places, and they're actually making supplies for healthcare workers. And I know that at Johns Hopkins Hospital, people came together and made something like 50,000 face masks for people who are working in the emergency department. And there are all kinds of other efforts to do that, to make sure that healthcare workers have access to the equipment that they need to stay safe.
Thank you. The next question is coming from Teresa from Beachfield.
Yes, I'd like to know. I mean, you're saying we can go out, but we have to distance ourselves. I mean, you're touching everything every minute if you're in the store, even during the senior hours. You're touching the doors, you're touching this. If we don't have enough sanitizer, I mean, I understand what you said, come back. It's just like inevitable to me. It seems like everyone's going to get it.
So, first of all, I would say that if it's possible, if you're in a high-risk group, to have somebody else do your shopping for you, or to call and get meals delivered or something like that, which is what the Maryland Access Point can do for some people, that is less risk than going to the store. If you go to the store, though, you have to take every possible precaution. Now, and that does reduce your risk to do that, and you want to stay away from crowds. You go during times where there's extra special protection, and be sure that you can wash your hands really well when you get home. I was going to say one other thing. You asked at the end, will everyone get it? And if we don't have a treatment or a vaccine to interrupt the spread, particularly a vaccine, eventually, probably nearly everyone's going to get it. But that could take, a long time. It could take 2 years. We don't want everyone to get it all at once, because here's the thing. Let's say you get sick with this disease. It does not mean you're going to die. In part, some people may die, but most people, 99% of people, can recover if the healthcare system's there to take care of them. So what we want to do is slow down the infection. Some people call that flattening the curve. Slow down the infection, space it out. So even though maybe everyone would get it eventually, we're going to slow it down so that as people get sick, there's always a bed for them in the hospital. That's our goal. And that way, we can save as many people as possible. Whereas if you throw up your hands and you say, well, I'm going to get it eventually, and you go outside and everyone does that, then there'll be so many sick people, a lot of people won't be able to get cared for in the hospital. There won't be beds or ventilators or anything else. But the other thing slowing it down does, even if it was going to take 2 years, is it allows us to invent treatments and find evidence for treatments and get a vaccine that protects everyone and figure out other strategies. So this idea that we have to live at home, that's not at all for 2 years. That's for right now. That's for right now, so we can buy some time to put in place some of these other measures that can then allow us to resume parts of our lives. It's not going to be like flipping a switch where we get to do everything that we used to do. And, it's going to be more gradual. I heard someone today say it's not like opening the floodgates. It's like turning the faucet. There'll be a moment where we start to turn the faucet a little bit, and we'll be able to do more things. And but the whole time we'll be watching the healthcare system. We'll make sure that everyone can be cared for. That's the situation we want to be in. So this is not a permanent state. It's just temporary to slow things down.
Thank you again, everybody. This is Council President Scott. I want to thank everyone for being here and for being very concerned about the coronavirus. We're going to now turn to Miss Sarah Matthews from Bolton Hill. Hey, Miss Sarah.
Yes, good evening, and thank you both for helping us out. My question is twofold. I would like for Josh to answer the question, and then I would like for Council President to answer secondly. I live in a senior building, and we are still having relatives and people from the outside to come into the senior building. And there are no restrictions. Seniors are still congregating in the community room, playing cards and bingo. Why is it that nursing homes can be prohibited from having visitors, but all of the senior buildings, both private and public, have not halted visitors from coming inside?
Now, Ms. Sarah, I'm going to jump in really quickly. So the public ones were supposed to already suspend all of that. So I know how to contact you. We're going to get on top of that for you. So we'll give you a call and we'll get that corrected, because we have to be protecting everyone by practicing social distancing and being responsible. So no one should be allowing those kind of things to continue on in the large numbers of groups. So I'll follow up with you directly. And Dr. Sharfstein, you can jump in.
I think it's very important that those types of activities stop right now, particularly among older adults who are at such high risk. And so I completely agree with the council president. I have heard, though, that this is an issue just in the last 24 hours. And actually, tomorrow, along with some people in the city, we're going to be talking to a whole bunch of people who run these types of apartment houses for older adults, as well as some tenants groups with older adults, as well as some lawyers for people who live in these buildings. And we're going to have one of the top experts talking to them about just how important it is, and we're going to review all the city guidance with them. I think it's just incredibly important that this be followed in these settings, because it's just an enormous potential risk. And I certainly would recommend that you not go to bingo or any of those other things to stay safe. And I think anything that I know that the city is working to make sure that message gets out.
Thank you, Dr. Sharfstein. And if anyone else on the call, this is the Council President, feels like they see a business that's open and it's not supposed to be, or things like that, please call our office at 410-396-4804, 410-396-4804, and we will get right on top of that. Next, we have Gloria Dean from East Baltimore. The floor is yours.
Yes, good afternoon. Thank you, Council President and the doctor. I have a lot of questions, but I'm going to answer one. My concern is that if the governor is like contradictory, if you say you don't want to let people shelter in, but a lot of things are being closed, and if everyone knows that New York is very, very heavy hit with this virus, and it looks like to me people are traveling out of New York, coming into Baltimore and wherever they need to go, why not shut it down? If they're really concerned about the virus, put people, shelter them in and shut it down, because as long as you're saying one thing and doing something else, people getting mixed messages. Either you're going to shelter in and lock it down where nobody from the outside can come in, because the governor said anyone from New York and other different states, when you come in, you must be quarantined. They're coming in and they're not telling anybody where's the honesty and loyalty at, and you don't know who's here. So people I know have come into Baltimore and went to visit some elderly people, and not even, we didn't think about that. They didn't think about it, but you don't know. We don't know who has it. You just gotta be mindful of what you do, where you go.
I'm good. Thank you. Thank you so much. Thank you for your question. I'm going to let the doctor and I respond. Dr. Sharfstein, you want to go first?
Yeah, well, I think that a little bit of nervousness and even paranoia is probably justified, in that, it may be that people you get in contact with, even whether they're from New York or not, could be carrying the virus, and that's why everybody's got to stay home as much as possible. I think, we know that even without New Yorkers coming here, that it's spreading in Baltimore right now, that you could go out, and if you are in contact with somebody who has it, that it's possible that, you or I could get it. And that's just, unfortunately, the difficult situation that we're in. I think it is really important for messages to get out there about how serious this is, and that's why, I'm doing calls like this to try myself, but through all kinds of other mechanisms. And I'm sure the council president has some ideas for how that can be done. But we really do want people coming from other places. I think the governor was right to isolate themselves or quarantine themselves for 2 weeks before they're in touch with other people, because there is a potential risk there, and I think you're correct to be worried about it.
Yeah, and I would just add, thank you for your question. This is the council president. Would just add that we have to be responsible and hold ourselves accountable, because when you look at even those states that have this shelter in place, like Ohio and some other places, they still allow people to go out to the grocery store, et cetera. But we ourselves have to be responsible as well. Next up, we have Katie from Glenn. Katie?
Good evening, everyone. My question is, I was admitted to Sinai Hospital on the 20th. I was taken there by AMBO. I had a really bad episode of vertigo. And while I was there, they did administer the test for the virus, and they they discharged me yesterday, the 25th. And I haven't gotten the results from my testing yet, so I don't know if I'm negative or positive. They told me to go home and quarantine myself, but they never gave me the results for the test. So what do I do?
Katie, thank you. And I'm hoping you're feeling better. I'm going to let Dr. Sharfstein go in, and then I will comment as well. Dr. Sharfstein?
So it sounds like you're feeling okay. Your voice sounds pretty strong, which is good. I would say that you should stay at home. You should not go to the hospital to argue the case with them. You should stay at home for sure. If you're home for 14 days, it almost doesn't matter, and you're feeling okay, it almost doesn't matter what the test was, because you're going to be okay. And so I would definitely stay at home. And then I think you should call and ask to talk to someone, for example, wherever they did the test for you. So you could call the floor of the hospital and say, hey, I was a patient and I want to find out my result. Or if you have even better idea than that is to call your own doctor, if you have a doctor, and to say, hey, I was in the hospital, will you go find out my test for me? And then let them figure that out. So I would say the test result is probably not as important as how you're feeling. And I'm really glad that you're sounding so strong.
And Katie, if you call our office, 410-396-4804, we will also follow up and try to get your answer as well. But we are glad that you're feeling better and hope that continues to be the case. Thank you so much for your call. Next up, we have Valerie from Ashburton.
Hi. Thanks for taking my call. I want to know, I have a friend that's used to be a physician, but she's retired now, and she hasn't been able to get in touch with someone to find out where she can go and to work, because they say if you're a retired doctor that you can also work to help out the people in Baltimore. So where would she go to get hired to work for this short period of time? Where would she call?
The Maryland Health Department has like a reserve corps of health professionals. So I think I would direct her to the Maryland Health Department website, and I'm trying to remember the exact name of what it's called, but I think it's called the Maryland Medical Reserve or something like that. If she can't find it, she could just call the main number at the health department, and she could just ask for that. And then what you do is you can sign up, and then they call you, and if they need you, they send you to someplace to help.
Thank you, Dr. Sharfstein. Next up, we have Patricia Holmes from Upton. Patricia?
Hi, thank you for everything, because I have a million questions in my mind, and I'm really kind of confused because I was told that I would like to know, how do you know you have it? I had bronchitis, and somebody told me that if you get a sore throat, if you get a fever. So I just know, is there stages of this virus?
Great question. It's not the same for everyone. People have different experiences with the virus. Some people get a sore throat, get a headache, get a little bit of body aches. Some people, a lot of people, when it's more serious, they get fever, they get cough, they get shortness of breath. Strangely, one of the symptoms that seems to be popping up is people lose their sense of taste and smell for a few days, and then it comes back. So that's been reported in 1 out of 5 cases. So it's kind of, there's no single thing, and it kind of sounds like it overlaps a lot with flu. It overlaps a lot with bronchitis and pneumonia. So you don't know for sure. If you have symptoms and they're mild, like it's just your normal symptoms or it doesn't bother you that much, then, it's okay to call your doctor, but you do not have to go in unless your doctor thinks it's a good idea. Because if you have a mild case, it may be better just to stay at home. You should not be going to work. You should be limiting your contact completely as much as you can with others and wearing a mask around them, for example, if you're living with people, and washing your hands like crazy, like I said before. But I think that if you don't have to go, all around the city in search of a test, because all they'll tell you is to go back home and to wait it out, even if it's positive. So, and only to seek care if you're really getting sicker. On the other hand, if you're getting sicker, you're having trouble breathing, something is very concerning to you, then it's definitely worth calling and seeking attention. But for most people with this, they do not need to be seen. They could just stay home. And, many people are calling me and I'm telling them just to stay home. And they go, well, I really want to go find a test. And I go, you're going to go out there and you might get coronavirus. So don't do that. Stay home, stay safe. And, you'll most likely get over it. And if you start to get worse, that's when you should go in for care.
Thank you, Dr. Sharfstein. And we're going to be wrapping up shortly here. So I'm going to ask you a quick yes or no question that a bunch of people have a question for. Is coronavirus something that you can get only once?
Probably yes, but we don't know for sure. And this exact coronavirus, probably yes. Now, this virus might change a little bit in future years, but it probably won't be as bad as the first time you get it. So this is really the worst that we're facing right now.
Thank you. This is going to be our last question, but everyone on the call is going to get a chance to leave a message, and we will respond to every message. Barbara in West Arlington.
Hi, thank you so much for taking my call. Right before this started, we had a broken water pipe in our house. The plumbers were here, they fixed it, but we have some water damage, a couple of holes in the wall that need to be repaired. We're both over 70. I have a history of asthma. Is it safe to have workers coming into the house right now?
I think my answer would be it really depends on how serious the damage is to your house, whether it's posing a risk to you. I would probably say if it's just sort of like a minor thing, that it's better to wait, just to be safe. Okay. You have to make your own judgment about how serious a problem it is. It's not huge risk if people come in and do social distancing and they're not sick, but any social contact is a risk. Any physical nearness is a potential risk. So you have to, be the judge. That's a bit of a gray area.
Thank you, Dr. Sharfstein. Just a reminder, that was our last question, everyone. We're going to do a wrap-up now. Just a reminder, Council President Scott, I thank you all for joining us. Thank you, Dr. Sharfstein. Everyone that has a call that wants their question answered, you're going to get a chance to leave a message on the voicemail. We will respond to every question. And if you aren't able to get it, you can also be sure to reach out to my office, 410-396-4804. We will answer every question. So you can leave a voicemail right after the call ends or call our office tomorrow. We will get to you. We just wanted to make sure that we had this so that everyone has the best information. We want people to stay at home at all costs, practice social distancing, just adhere to the advice. Continue to look at BaltimoreCityCouncil.com. I'll be pushing out information on social media as well. To stay safe, everyone. We can do this together. Thank you, Dr. Sharfstein, and I will give you a couple seconds to wrap up.
Sure. I'm glad to wrap up for that last caller. I got a text message from someone else listening in who said, that they might be able to give you some advice virtually. If you were able to take a picture and send it to them, they could tell you whether it makes sense to get fixed or not. And I'm sure that the Council President's office could connect you up to them at Green and Healthy Homes if you call in and explain the situation with the water damage. So first of all, I just really want to thank you, Mr. Council President, for doing this, and thank everyone for the great questions that you've had. It's really important to talk about this, and not just to talk about it with the City Council President, but with your friends, with your children, with your parents, with your cousins, people that you know. It's just so important that we all educate ourselves, because we can take action to protect ourselves and the people around us. Thank you.
Thank you, everybody. This is Council President Scott again. I want to say thank you all for being here. Remember, you can call our office at 410-396-4804, and also be sure to follow us on social media, facebook.com/CouncilPresBMS and at CouncilPresBMS on Instagram and Twitter. And remember, you can always call our office, 410-396-4804. Thank you, Dr. Sharfstein, again, for always looking out for the citizens of Baltimore. Good evening, everyone. Stay safe.
Thank you again, everyone, for recapping our telephone town hall with us live on the internet. Please be sure to share this with your friends, family, neighbors, and coworkers, as this information could be life-saving for someone. And as a reminder, you can be reached via direct messages on Twitter, Facebook, and Instagram at CouncilPresBMS. My staff and I will be sure to get back to you, or you can email us directly at councilpresident@baltimorecity.gov, or call us 410-396-4804. Stay healthy and stay inside, everyone.